Hi, my name is Michael Stern. I'm the physician champion for vascular access, as well as the surgical ICU director at Corewell Health East in Dearborn. So for me, the roles that I have and the opportunities that I've been given to really change people and their outcomes is kind of what's most profound to me. I find that in the role as a director of the ICU, I get to start helping from ground up, from the environmental services to the nurses to the RTs to especially the physicians, the residents, and really help implement everybody's ideas and come up with ways that we can improve patient outcomes from start to finish, and especially with the vascular access role in the forgotten realm of the vascular access lines that we put in. From peripheral lines to central lines, there's just the need to focus from start to finish every role involved to make sure that those lines are placed safely so that patients have the best outcomes. There's a lot of need for physicians to pay attention to what is happening with their lines. We talk about surgical devices in surgery and surgical incisions. We talk about how do we do anastomoses better so they don't leak and get infections. How do we prevent infections by not placing drains when they're not needed? Or what do we do with wounds afterwards to help make sure that they're cared for best? But rarely are you going to hear somebody in a physician's side talk about what do I need to do for my devices that I've inserted to somebody in an ICU, in an ER, these central access lines, these peripheral IVs. What's happening with those wounds? How am I putting the dressings on? If you ask a physician what's most important about a dressing that you're putting on a new central line, a lot of them can't answer to you what's important about that line, let alone know how to put proper dressings on and why it's important to put that dressing on. And if we can address that part and actually get people to start paying attention to what was originally discarded as hey, it's just a peripheral line, no big deal. I think that people are starting to recognize that a peripheral line is just the same risks as a central line. And at least at our hospital, people are starting to hear the words hospital onset bacteremia, HOB, and start realizing that maybe I don't need 3 peripheral IVs on somebody. Maybe 2 is what I need, or maybe I can get away with just 1, or maybe it's time to take it out or replace it and really start to make sure that people don't get the complications that they don't need. What drives me is that, as an engineer, I asked throughout my training in med school, residency, it got me in a lot of trouble throughout med school residency to say, why do we do it like this? Why are we doing this? Why are we doing that? This doesn't make sense to me. Tell me the reason that we're doing this. And of course, everybody loves in medicine to say, well, this is the way we've always done it. And that's not good enough. Anytime somebody says that's how we've done it, I say, is that how we should do it? And I think that's what needs to be asked more is from the ground up. The environmental service people, if they can't clean a room properly, then we're going to get infections in that room. And so if every person said, why are we doing it this way? And can we do it better? I think that every step of healthcare would improve. And so for me, until I can really be confident to say that everybody is at the point where they can do that, I think what drives me is to get that empowerment across the board and be able to say at the end of the day, like, yes, we did the best we possibly could. And whatever good outcome or bad outcome we had, we're going to take that lesson and drive it to the next person. And if I get to sit next to a family member and take the time to say, this great thing happened, what part of it was most impactful for you? I can take that and help push that in. Or if I have something that really just didn't go the way we wanted, and I can say to a family member, like, did you feel that you were heard? Did you feel like something could have been better? We felt like we could try our best. This is why. But what do you think we could have done better is always the question that should be asked. And, take that and kind of roll it back in also.